Hi, Dr. Marcia here in another of my series on coping with COVID. And today I want to answer a question about how do I know it's sadness and how do I know if it's depression? And clinical depression is quite different than sadness. And there are three main reasons why sadness and clinical depression are not the same thing. The first point is that if you have sadness, you're going to be feeling sad. And most of the time it's going to be not all day long. You're going to feel sad sometimes and you're going to feel, better sometimes. But with clinical depression, you're going to have a difficulty with mood variability, so that you're not going to be able to have your mood lifted. You're not going to be able to get cheered up by the normal things that usually cheer you up. With sadness, you're going to have things that can cheer you up. So if you spend time with your children, that will cheer you up. Or if you have a nice time with your partner, that will lift your mood. But if you have depression, even the things that really make you happy, like your children or your partner, won't necessarily cheer you up. So that lack of mood variability is the first sign that you might be clinically depressed. The other sign that you might be clinically depressed is, like I said, if you're sad, you're basically sad. But if you're depressed, you can have a multitude of different emotions. You can be irritable, agitated, you can feel numb or blah, you can feel restless, you can feel flat, and you can feel worthless even, and even be consumed with guilt or shame. So if you have depression, clinical depression, you're not just feeling sad, you can feel empty. So it's not a normal type of sadness. There are many different emotional experiences you can have while you're depressed. And the third thing that happens when you have clinical depression as opposed to sadness is that you have changes in your appetite, your sleep patterns, and your energy. With clinical depression, you can have a lot of excessive appetite where you're eating all the time and you never have enough, or you can completely lose your appetite and forget to eat for the whole day. You can have difficulty sleeping where you just wake up in the middle of the night and you can't get back to sleep, or you can sleep for 12 hours every day and wake up not feeling rested and refreshed. And with your energy, even if you've had an 8 or 10 hour sleep a night, you're going to wake up and you're going to feel very tired and very lethargic. So the lack of mood variability, the multiplicity of different emotional reactions, and the difficulties or the changes in your sleep, your energy, and your appetite are all things that can differentiate regular sadness from clinical depression. And I want to share just a few signs of clinical depression with you today, so that if you have any of these signs, that can alert you to the possibility that you have more than just normal sadness. So the first sign that you might have clinical depression is if you have decreased interest or pleasure in your normal activities. If you have normal sadness, you generally can still take interest in the things that you enjoy. But with depression, you lose all interest and nothing matters to you anymore. The other sign, that's number 2, is a lack of motivation. You just don't have the energy. You just don't want to bother doing anything. You don't feel like showering. You don't want to make your bed. You don't want to make food for yourself or your children. You just don't want to bother doing anything. So lack of interest and pleasure is the first, and lack of motivation is the second. And the third sign that you possibly have clinical depression is something called diurnal variation, which is when you wake up in the morning and you actually feel worse. For most people who are sad, they wake up in the morning and they feel better. It's a new day. They start out feeling refreshed and they're in a better mood. But with clinical depression, you wake up and you feel terrible and you just want to pull the covers over your head and go back to sleep. So that diurnal variation, or that variation in the daytime rhythms, is a pretty typical sign of clinical depression. The fourth sign that you might have clinical depression is cognitive changes. So when you're normally sad, you're not going to be forgetful, absent-minded, have difficulties with your concentration or focus. But with clinical depression, you can start thinking that you have some kind of dementia because it can be so severe. And for elderly people, very often you really need to differentiate between dementia and depression because they can look almost exactly the same. So cognitive difficulties, problems with focus, attention, concentration, memory, all those things are a very typical sign of clinical depression. And the final sign that you might be having clinical depression are fleeting suicidal thoughts or suicidal plans or even suicidal intention. And that is a psychiatric emergency. If you're having any suicidal thoughts at all, you want to talk to your family doctor or a mental health professional. And if you have any plans or any intentions, you need to go to the nearest emergency department, because it's very important that you get immediate care for that. Now, the things that you want to do for sadness and for depression are a little bit different. Some of them overlap. If you have mild depression or general sadness, normal sadness, then there are 3 basic things you want to do. So there's mental health self-care, which constitutes gentle exercise, mindfulness, meditation, and breathing exercises, good nutrition, and sleep. So that's the first thing. The second thing is talk to people. You can talk to family members or friends, or you can talk to your family doctor or a mental health professional, as long as the people you're talking to are going to be supportive and understanding, and they're not going to minimize or dismiss your emotional experience. And the third thing you want to do if you have sadness or mild depression is be there for others, because helping others will lift your mood. It will do good things for the other people, but it'll also make you feel a lot better. Now, if you have serious depression, it's a slightly different story. With a serious depression, you really need to talk to a mental health professional. If you can't, then your GP will do, but it's preferable if you talk to someone who is an expert in mental health, so that they can really guide you through this process of getting better from your depression. And the other thing that you might need is actual long-term psychotherapy, because perhaps your depression is coming from some childhood trauma or some unresolved issues that you really need to work on. And so you may need some immediate counseling just to help you cope with your immediate symptoms of depression, but then you might need some long-term psychotherapy to help you really process whatever is going on inside you, so you don't get depressed again. And the other thing you might need if you have serious depression is medication, because it is a brain illness, depression, and it very often requires medication to reboot your brain so that you start to feel better. And you don't need to worry about medication. Today we have excellent medications that are not addictive, they don't change your personality, and they don't make you feel worse. They just take away your sad and low mood, and they make you feel more motivated and able to take interest and pleasure in things. And of course, they help with your sleep and your appetite and your energy. So medication is a very good option if you're very seriously depressed. And of course, like I said before, if you're having any suicidal thoughts that are more than fleeting thoughts, that are plans or intentions, you really need to immediately contact a mental health professional or go to the nearest emergency department to get immediate care for this mental health crisis. So please, everybody, stay safe, keep your heart open, practice social distancing, keep sheltering in place. The worst is not over, unfortunately. It's still going on for a while, and we need to all be smart and make sure that everyone is safe and all our healthcare professionals are safe, so that the healthcare system stays intact. And stay tuned, please, for more of my Coping with COVID videos.